This is episode 2 on the lithium series, and today we're going to be discussing pharmacokinetics. Lithium is like walking on a balance beam. Powerful if you stay centered, but one slip and you're in danger. That's why examiners love pharmacokinetics. How lithium moves through the body explain why it's so tricky. So let us walk that narrow road. How is lithium absorbed? When you take lithium, it's rapidly absorbed in the GI tract and it peaks within 1 to 3 hours. And this is for standard lithium carbonate. And lithium is distributed in a way that, it doesn't bind to protein. And this makes lithium very, very unique. It crosses the brain barrier really slowly. And this might explain why stabilization kind of takes a little time. And how is it excreted? Here's the big one. Lithium is not metabolized. Very important. And it is excreted 100% by the kidney. So if an individual does not have a working kidney, they don't need to be on lithium. And that's why it's very important that before we start any individual on lithium, we must check a creatinine level. And any medication or any situation that will affect the kidneys is going to lead to lithium toxicity. And always remember that individuals who are within that childbearing age must have HCG checked before they are started on lithium due to Epstein-Barr anomaly. So because lithium is 100% excreted by the kidney, this means that the kidney does all the work. Again, anything that affects sodium or kidney functions affects lithium. One thing you have to know is that sodium is a salt, and if you have low sodium levels, your body is going to absorb lithium. If that individual is on lithium, it's not going to differentiate which, and this can lead to lithium toxicity. And along the series, we will discuss patient education and what is expected for you as a provider to educate your patients. And lithium would usually stay the half-life is about 24 hours in a regular adult, but it can be longer in elderly due to impaired kidney. As people grow older, kidney functions tend to reduce. Even when on a steady dose or a stable dose of lithium, an individual can still become toxic if that renal function declines, if that individual becomes dehydrated, if that individual reduces sodium intake. So regardless, if they've been stable, we still need to do routine labs on individuals so that we can mitigate issues associated with toxicity. So what are the baseline labs? Because lithium depends on the kidney, it's important that we check our electrolytes. That means we want to be checking that renal function, BUN and creatinine level. We want to check our TSH and pay attention specifically to sodium. Pregnancy test is also important before we start lithium, just to protect against birth defect. For instance, let's look at a case study. A 70-year-old woman on lithium develops confusion and tremors. Her lithium level is 1.1, which seems to be normal. 1.1 milliequivalent looks therapeutic. So why is she toxic? The answer will be because renal clearance declines with age, and lithium isn't metabolized. So it is 100% excreted by the kidneys. The exam loves this line. Lithium is not metabolized. It is renally cleared. That's why hydration, sodium balance, and baseline kidney labs are so crucial. So let's remember that this video is for educational purpose only, not a medical advice. So stay balanced, stay